Hello there. My name is Marilyn from Maya Health Wellness. I'm a healthcare provider working in a patient clinic. In this channel, we're going to look at some of the factors that promote well-being and of course look at some of the things that we go through as a healthcare provider. In my previous video, we look at some of the things that we go through as a healthcare provider in health facility. And one of the key things that are touched there was some of the symptoms for malaria. And as I promised that we're going to look at malaria. So today's topic, we are going to discuss about malaria in children. Before we start, for those who are joining us for the first time, karibuni sana. For my returning subscriber, thank you. Don't forget to like, subscribe, share, and of course hit the notification bell so that you can receive the video whenever I post them. So now, malaria is a major cause of illness and death in children under the age of 5 years old. Despite the interventions and prevention measures taken against malaria, it continues to take a heavy role on health and a way of living in substantial part of the world, especially in sub-Saharan Africa, Asia, and some of the parts of Central and Southern America. Malaria infection impact growth and development in children, which causes impairment, disability, direct effect on motor skills, and of course it also affects cognition, malnutrition. It also lower down immunity of those particular children, and of course suppress appetite for these children. In extreme cases, severe malaria can also cause anemia. It can also cause hyperglycemia, cerebral malaria, that are commonly seen in children than adults. What is this that we understand by the word malaria? You know, some of us might just think, because in most cases, someone will come and tell you that, oh, I was rained on, and as a result of that, now I have malaria. Does malaria, or is malaria caused by being rained on or consuming something? So that is what we're going to look at, the diagnosis for malaria. We'll also look at some of the symptoms of malaria, and then we also look at option treatment for malaria, and lastly we look at preventions of malaria. For those who have not subscribed, please don't forget to subscribe, hit the notification bell, share, and let's learn together. Malaria is a serious and sometimes fatal disease caused by parasite that commonly infect a certain type of mosquito which feeds on human. So now the main intention of these mosquitoes are not to cause infection, but whenever they're taking a blood meal, that is when they ingest the parasite that is causing malaria. Transmission normally occurs primarily through bite from infected female Anopheles mosquito, and less frequently from blood transfusion and from mother to child via placenta. Then the newborn presents with congenital malaria. Now we have some of the signs and symptoms of malaria. Early symptoms of malaria can include irritability and drowsiness that we see in small children. There's also poor appetite, trouble sleeping. These symptoms are usually followed by chills, then fever with the fast breathing. Then the fever may either gradually rise over 1 to 2 days, or it can even spike very suddenly to 40 degrees Celsius or even higher than that. Then as the fever ends and the body temperatures quickly returns to the normal, there is intense episode of sweating that comes once the fever has stopped. And the same patterns of we have chills, we have fever, and we have sweating may repeat itself for 2 to 3 days, depending on which malaria parasite cause the infection. So different types of mosquito species cause different presentation. So depending again with the type of the species of that mosquito, the presentation are going to be different. Other signs and symptoms for malaria include headache that we can see in older children and adults. There is also nausea and vomiting. There is diarrhea that is commonly seen in small children. There's also muscle ache and joint pains. And also there is pain that somebody can tell you that they have generalized body pain. If malaria affects the brain, sometimes it might have convulsions or loss of consciousness. But again, it's not only happens due to malaria. If children have high temperatures above 39 degrees Celsius, then one of the most common complications that sets in, as we've seen in our previous video when we talk about fever in small children, are convulsions. But of course, malaria can also pass the blood barrier, and then of course cause some of the central nervous system presentation, whereby we have now convulsions. So now, if malaria is not promptly treated, and then the infection becomes severe, in many cases it can cause kidney failure. It can also cause convulsions. It can cause mental confusions that we see in older children and of course in adults. Coma and death can result as a result of those severe malaria. The symptoms begin from day 7 to 4 weeks, or later as a year, depending again with the species of mosquito. And then again, we also have some of the types of species that have tendency of relapse. For instance, if when we're talking about the transmission, if a mosquito takes a meal bite and then it ingests those parasites into their system, and they travel from the bloodstream to the liver. So now, during that incubation period that we talk about, 7 to 14 days, and then it releases it from the liver back to the bloodstream. And now those species of mosquito that remain dormant in the liver. And then after a longer duration, that up to that 1 year that we're talking about, then after being treated, and then it can relapse again, and of course you still have those symptoms for malaria that cause disease again. So now that we've looked at some of the symptoms that are present with malaria, next we're going to look at how is it that we diagnose malaria, how can we treat malaria, and lastly we're going to look at some of the preventive measures that we can take in order for us to prevent getting malaria. Again, for those who are my new subscribers, kindly don't forget to like, subscribe, hit the notification bell so that you don't miss any of our upcoming videos. For my returning subscriber, Asanteni, share. Let us all learn together. And remember to leave me a comment. Tell me anything that you want us to discuss, or there's something else that you are not so clear about in this particular presentation, so that we can all learn together. Now, how do we diagnose malaria? As you have seen above those various presentations for malaria, what are some of the measures? How can we tell that somebody has malaria? So now, malaria can be confirmed by blood tests that are carried out in health facility. Of course, there are those rapid tests that can be carried out at home, but we always encourage parents, we also encourage caregivers and carers that these tests be done in hospital. And then again, if there's any other complication that arise due to malaria infection, then it can be promptly treated well in health facility than being done at home. So now, once the blood slide has been carried out and the results are out, and then this individual or these children are started on anti-malaria, depending again with the severity of malaria. For those who have mild malaria, or the test result turns to be positive, but they have mild disease for malaria, then they can be given per oral medication that they can take at home for a shorter duration and then recover. For those who have a severe form of malaria, and of course they have some other complications that are set in as a result of malaria, and then those one will require to be initiated on injectable medication or injectable anti-malarial medication, and others can even be initiated on intravenous medication for particularly for malaria. And now, we remember when we were discussing about some of the symptoms for malaria, and we were talking about vomiting in small children, and it can either be in adult and older children too. So there's vomiting and there's diarrhea. So now these children have lost fluids due to this presentation. Then of course IV fluids can be initiated whenever in order for them to be well predated, and of course also to replace some of the electrolytes that they lose during the time that they have malaria. Now we look at we talk about dehydration as a result of those loss of fluids due to vomiting and of course diarrhea. And some of the complications that we look at, or some of the things that can come as a result of malaria, we talk about convulsions, we talk about anemia, and also we talk about some other effects. For instance, if the child has effect of malaria or effect on the brain as a result of malaria, or if they have a kidney problem or even spleen problem, then the patient may need to be given fluids, blood transfusion, and of course for those who have respiratory distress or fast breathing, difficulty breathing, or even shortness of breath as a result of those complications for malaria, then can also be initiated on proper treatment while they're at health facility. So now, what are these preventive measures that we can take in order for us to prevent malaria? Because we can see malaria is caused by, we have said that it's not caused by either one, by contact. Some people might think that malaria is being caused by contact, or it's a contagious disease, or even when they're being rained on. So now we find out that malaria is caused by mosquito bite that ingests those parasites into our system that end up causing malaria. So now what are some of the measures that you can take in order for us to prevent malaria? Now, for those individuals living in malaria endemic zone, and of course malaria is more common during raining season. One, because there is stagnant water or stagnant water around the homestead or the offices where people are found. So ensure that there's proper drainage for those stagnant water. Or number two, get rid of those water, because those are some of the breeding ground for mosquito. They could also be used for mosquito nets at night. The use of mosquito nets, of course, and then there's insect repellent that you can use to apply on your body in order to prevent you from getting those bites from mosquito. And of course, for those who are traveling, or we have migrants, people who are traveling from one region to the other, if at all you're going to travel to malaria endemic zone, so there are those use of preventive anti-malarial drugs that you can take before you travel. Again, for those who are in those endemic zone, remember to put on long sleeve during the evening, because from 5 p.m. that is when the mosquito starts to bite. So ensure that you put something that is long sleeved in order to prevent you from being bitten by mosquito. That comes to the end of our topic today. For those who are joining me, or those who joined me for the first time today, thank you so much. Don't forget to like, subscribe, hit the notification bell, share, and of course, let's learn together. Don't forget to leave me a comment below. Tell me about the experience that you've had, either one taking care of somebody who was ill because of malaria, or your experience when you had malaria. And of course, some of the measures that you think that we can also add in order for us to prevent malaria. And of course, let us be our brother's keeper. If you see that your brother is not doing something that can also help us all prevent from having malaria, then let us find the best way on how we can educate them in order for us to prevent malaria. Until next time, thank you so much. Ciao.